All right, continuing on with your health history, I see here that you have family history of CVA and you have high cholesterol. Are you still taking Lipitor for that?
Yes.
Have you felt any weakness due to it?
No, I do have a headache.
Have you taken anything for that?
Tylenol?
Has it helped the pain?
I think so.
All right, if there are any changes to your headache, let me know. All right, Mr. Dominguez, I'll be taking your vitals now. All right, your vitals are a little bit higher. Blood pressure was 135/85. Your heart rate is within normal limits. It was about 90 beats per minute. How are you feeling?
I feel dizzy.
Feeling a little bit dizzy. Will you go ahead and smile for me? All right, will you extend your arms out, palm up, facing? Close your eyes for 10 seconds. All right, so it seems that you're a little bit weaker on your right side. Your lip was drooping on the right side as well. Will you repeat after me? The sky is blue.
Sky is blue.
All right. Hey, Wolf. My patient is showing signs of a stroke. I have an emergency with them. If you can just contact the DDS and faculty for me, thank you. All right, doctor, here's Mr. Dominguez. Health history, as well as his drug card. He is taking Lipitor. He has high cholesterol. I did notice that one of the side effects of Lipitor is stroke, and he is showing symptoms of a stroke. He is complaining of dizziness. He also had a headache when he came in. His vitals, his blood pressure was a little bit high, 135/85. And I did the fast warning signs on him. His face was drooping on the right side. His arm was weak on the right side. His speech was slurred a little bit. Since his vitals were a little bit high, I will be retaking his vitals. And it has almost been 5 minutes, so I will be retaking his vitals. And I will put him in a comfortable semi-supine position. I have instructed the nearest student to call EMS and bring the emergency kit and oxygen. All right, Mr. Dominguez, I'll be taking your vitals once more. Okay, blood pressure is still elevated. I'm going to place you in a supine position while we wait for the emergency kit. Here's the emergency kit and everything needed in case the patient becomes unconscious and they need basic life support, as well as the oxygen for now. All right, I will be placing oxygen at 4 liters per minute as instructed by the DDS on Mr. Dominguez. What will you do if the patient loses consciousness? If the patient loses consciousness, I will place him in a supine position. I will monitor their vitals, I will continue oxygen, and I will maintain their airway open while I perform basic life support on them until EMS arrives. I will record the proceedings and sign patient progress notes. Which ASA classification would you consider them now, and what preventative measures will be taken in the future? The patient is now considered an ASA 4, which means they won't be able to receive any elective dental treatment. Additional preventative measures will be taken, such as postponing elective treatment for 6 months, using stress-reducing methods, being thorough with their health history, and modifying treatment based off their vitals and health history. They will be ASA 3 once it has been more than 6 months prior to dental treatment with no significant residual signs or symptoms of a stroke, such as the dizziness, the confusion, increased blood pressure or heart rate, dysphagia, aphasia, nausea, paralysis, such as numbness or weakness of the face, arm, or leg on one side of the body, trouble seeing in one or both eyes, unequal pupil size, trouble walking, loss of balance or coordination, severe headache with no known cause. If the patient shows any symptoms when they come in, I will start the fast warning signs. FAST stands for face, arm, speech, and time. For face, you ask the person to smile and make sure that one of the sides of the face isn't drooped. For arm, you ask the patient to hold out both arms, palm up and eyes closed for 10 seconds to observe for weakness in an arm. And for speech, you ask the person to repeat a simple sentence and make sure the speech doesn't sound slurred or strange. And T is for time.